Well, a warm welcome to today's talk. It's Tuesday, the 27th of April. Now, globally, cases are still increasing at the moment. So this is what we see globally as of this morning, and we do see that cases are carrying on rising. Now, I know we're enjoying really quite significant improvements in many parts of the world. In the UK, we're enjoying significant improvements. We're not there yet, but the direction's good. But globally, I'm afraid it is not. And this is as we head into spring and early summer, indeed, certainly spring in the northern hemisphere. So this is concerning, and a lot of this, as we know, is the new variants that have emerged. And of course, this is illustrated nowhere more powerfully than India. So let's have a look at what's happening in India now. In fact, let's have a look at some graphics just to contextualise this. Here we have new daily confirmed COVID-19 cases per million people. So we see that the UK is going down. The United States, thankfully, it's quite a relief. We'll maybe talk about that later, but the United States is going down. But India is slightly higher than the United States in terms of cases per capita. But when we look at the testing, we see that India is testing way less, certainly compared to the UK, and quite a bit less than in the United States. So what this means is these cases are grossly underestimated in India. And as we'll see later on, perhaps about 25% of the deaths in India are being officially reported as COVID deaths as well. So the official statistics grossly underestimating the pandemic in India. This is not suggesting that there's a deliberate cover-up, but the systems are slow and in some places essentially non-existent for recording these things. So always very important to remember that in the context of the amount of testing. Just looking at a little more context, share of people who've received at least one dose of COVID-19 vaccine. So the United Kingdom, the United States, both going well. India, it's way down at quite a bit less than the 10% line. So another reason why things are problematic in India, the slow rollout of the vaccine. Partly because the population is just so large, this just takes a long time and it requires a huge amount of logistics because of the 1.3 billion people. Just briefly there, the situation in Europe. So the UK, Portugal, Denmark, Germany, Netherlands, Sweden. So, well, cases increasing in places like Sweden and Netherlands overall. Germany at best flat. France is probably somewhere similar to this. So, again, no obvious respite with the better weather in Europe. Now, this is interesting. Case fatality rate of the ongoing COVID-19 pandemic. So, case fatality rate, as you probably know, is the number of people that die compared to the number of people that are formally diagnosed. This is going to be a lot higher than the infection fatality rate because a lot of people who get the infection aren't formally diagnosed. But this graphic is impressive and encouraging. And we see that the case fatality rate in the UK has dropped off really quite dramatically from over 14% there to way down to well, it's about 3% there, isn't it? In the United States, it's under 2%. Now, of course, this is not saying that 2% of people in the United States who get the infection die. It's way less than that. These are those that are formally diagnosed. And of course, this massive drop-off has been caused by the protection effect of the vaccination program. Now, one thing that really has disturbed me, actually, I was going to say annoyed, but annoyed's not strong enough. It's disturbing. People who are advocating therapeutics are sometimes anti-vaccine, and people who are advocating vaccines are sometimes anti-therapeutics, and again, sometimes anti-preventatives as well, seeing vaccines as the only modality of prevention. Now, of course, it's vital. This graphic shows how vital it is. But let me tell you, I want preventives. I want vaccines and I want therapeutics as well. So let's try and get away from this sort of territorialism that seems to have developed on social media. Any weapon we can get to clobber this virus, I want it. We want this pandemic over and done with. We want people to stop dying. And in this particular example, we see vaccines are effective at that, because it's the vaccination that's reduced the case fatality rate. Can't remember who painted that, but that's from a while ago. The virus stalking the countryside. My apologies to the artist, I can't remember. Okay, so that's a bit of context. Now, here we are looking at India. So cases, these are the officially diagnosed cases, underdiagnosed, of course. So that was yesterday, that was the day before. Well over 70 million officially diagnosed cases. Deaths about 2,800 per day now. That's a lot, and that's nearly 200,000 deaths. But the reason that we're saying that the deaths are so underestimated is we're getting fairly accurate reports from cremation grounds. Hindus, of course, cremate. We're getting fairly accurate data from Islamic and Christian burial grounds in India that the amount of cremations and burials are massively more than this. And it looks like this probably represents about 25% of the total. So unfortunately, and this is just tragic to say, but it could well be that about 10,000 people in India are dying a day now. And it's getting worse. This is an absolute calamity that's unfolding in India. It's made worse by a thriving black market and an unprepared government, both national governments and regional state governments, massively underprepared. So, for example, oxygen is selling at hundreds of times the normal price. Now, what is happening a lot of the time in India is the hospitals are running out of oxygen, and they're saying to their relatives, well, your relative who's sick needs oxygen, go and get some. And that's why there's a thriving black market, people paying hundreds and hundreds of times the proper price for oxygen. Same in therapeutics, there's hoarding and there's black marketeering. It would be foolish to say that corruption is not a major problem in many parts of India. And the unpreparedness of government. Now, on this channel, and indeed we keep clicking the wrong one, sorry. On this channel, and we did talk about communicating with the health service and things on this back in January, February 2020. I said, clearly we're going to need an awful lot of oxygen. Now, rightly so, in those early days, the governments around the world focused on making huge amounts of ventilators. But it turned out that they weren't thankfully needed, but what was needed is oxygen concentrators, and we just haven't been sufficiently prepared for that. Why aren't the engineers developing really nice small oxygen concentrators that we can pack off around the world? I'm sure they are now, but this was actually, I anticipated this getting on for 18 months ago now, well, January 2020, and it was clearly going to be a need, and unfortunately the Indian authorities weren't prepared, or not sufficiently prepared, shall we say, with some hospitals running out of oxygen, which of course is terrible. Now, this is the 300,000 line there, new daily cases. Well, as we've seen, over 300,000 for those last 2 days, and here's the graphic, well over 300,000, and this is the rate of increase, and it really is hard to see this stopping for the next period of time. Are we talking days? Are we talking weeks? We don't know, but there's an absolute disaster unfolding in India as cases keep on increasing. Deaths, of course, aren't too far behind. Deaths now, as we've said, about 2,800 per day, officially diagnosed. Although, unfortunately, we know that the number of burials and cremations are about 4 times that as the deaths carry on increasing. So is it times 3? Is it times 4? Probably round about times 4 from the data from burial and cremation grounds. This is just a terrible, terrible situation. Now, thankfully, and we have been appealing for this for some time, the international community is starting to respond. US is allowing export of vaccine components. Now, we don't know the detail on this yet, but we called for this loud and clear last week on this channel. We called for this loud and clear 2 days ago on this channel. 2 days ago on this channel. And Prime Minister Modi has been talking directly to President Biden And it looks like President Biden may have intervened directly to suspend this aspect of the Defence Procurement Act. So that is really good news. They're going to get these components, these whatever they are, the ingredients for the vaccine, off to India, where they can make millions more vaccines. Good. Now, the United States, of course, has not confirmed the AstraZeneca vaccine, so they're looking at 60 million potentially being exported, mostly to India. This is going to take a bit of time, but it'll help. It'll help. But remember, we've got 1.3 billion people, only 130 million are vaccinated so far. Long way to go in India. But the domestic vaccine production that will be significantly ramped up as a result of this intervention will be excellent, and is encouraging. US is sending medical supplies, but importantly, no intellectual property waivers yet that would allow alternative people to produce vaccine. Now, I know there's downsides to that. It means that the Chinese could start making it, and they could increase Chinese vaccine diplomacy, and the Russians could start making a Pfizer and a Moderna vaccine of their own, and they would use that for their own purposes. So basically, I'm not qualified on the geopolitical influences of that, but we need to look at something that increases vaccine supply. US sending medical aid to India, Spain sending medical aid to India, Germany just getting their act together to send medical aid to India. But in the meantime, a lot of people dying unnecessarily, a lot of people dying simply through lack of oxygen. Factors in India, well, there's been the large Hindu festivals like the Kumbh Mela, people sleeping 20 to 30 to a hotel room, sharing unsanitary toilet facilities. There's been a lot of political rallies that are still going on in India, quite inexcusable. And there's 3 new mutants, 3 new variants that seem to be driving this infection as well. Now, my understanding is that the United States is still accepting flights from India. This is simply, in my view, madness. If the United States is still accepting flights from India, it's just absolutely incredible, because we don't know the proportion of the increases in India that are caused by the religious festivals, by the political rallies, by the slow vaccine rollout, or is the vast majority of it caused by these new variants that could spread to the United States? Why not just suspend flights for a period of time? It is just unbelievable. Right, a bit of better news now before we carry on. Right, Office for National Statistics in the United Kingdom, always out of date, of course, but the directions are good. So England, this is the week ending the 16th. It's nearly 10, it's 11 days ago now, isn't it? It was the week ending the 16th. Full data is now available. In that week, 90,000 people had the infection. That's 0.17% of the population. That is 1 in 610 people, and that is down from 112,000 the week before. So that is a good reduction from the week before, down from that to that. So that's good. But Wales, prevalence the weekend in the 16th, 3,600 people, 0.12% of the population, slightly lower. 1 in 840 people. But the week before it was actually lower. So there's actually been a slight increase in prevalence from the week before in Wales. Not good. So flat to the Office for National Statistics says basically the same. So I think they're happy to say that these are within the same sort of margins of error, but it means it's not going down the way we would like it to. Northern Ireland, 2,800 people, 0.15% of the population, 1 in 660 people. 2,800 the week ending the 16th. The week before, the week ending the 10th, 2,600. So again, very minimal. That's basically flat. Those are basically the same numbers. So, we would really like to see a continued reduction in the UK. So the numbers are still lowish. They're lower than they've been for a long time. But it's not going away. Prevalence in Scotland, 9,300 people, 0.18% of the population, 1 in 560 people. Down from 10,500 the week before to 9,300 on the week ending the 16th. So again, not a massive drop-off, to be quite honest. Now, this is more encouraging. This is the percentage of people, the percentage of tests that were positive. So this has gone down from about over 2% here in January at the peak. So this is the peak here, isn't it? January was the peak about then, peak of the pandemic or this wave. Now the positivity rate is going down nicely to well under 0.5. In fact, there's about 0.2%, isn't it? Now, what this means is there is way less community transmission of the virus. So this is encouraging, and hopefully it's down a little bit more now. Now, I think I'll just show you a picture of the deaths from the UK. Here we see it here. Now, the blue line is the deaths involving COVID-19. The green line is the deaths not involving COVID-19. So we see here in the first wave, a lot of the deaths were COVID-19 compared to the non-COVID deaths, and likewise in the second wave. But we see the proportion of deaths caused by COVID-19 and people dying from other things here, percentage-wise, much higher. And there, it's actually about that the week ending the 16th of April. It was actually 3.5% of deaths were attributable to COVID-19 in that week. And this line here is the average deaths for that period of time. So we can see that lately, although there's some bank holiday influences, that they're actually lower, lower than normal. So about 3.5% of deaths there attributable to COVID-19. So that is certainly encouraging. Reductions indicating less community transmission. Now, what about the situation now in the UK? Here's some summaries. So people testing positive on the week down 6.5%, so that was good. Deaths within 28 days, a positive test down 6.9%. Patients admitted down 23%. That's going very well. And then you can look at all your local data there. I always include the links, of course. And if we look at the graphs for the cases, again, we see that dropping off really quite nicely, but still flattish there, not going away. Healthcare, again, many less people admitted to hospital, way less people admitted to hospital. And the amount of people actually in hospital, have we got that? Yes, we got that. So this is patients. No, that's patients admitted to hospital. Oh, we haven't got patients in hospital at the moment, but these are the number of patients ventilated, so that is down. So the number of patients admitted to hospital, and we do know that the number of people in hospital is also significantly reduced. Looking at deaths, again, we see greatly reduced numbers, partly because of the reduced cases, and partly, of course, the great protection against severe disease and deaths that the vaccines confer. So at the moment, we are going the opposite way to India. I'm pleased to say we're going the opposite way for the UK. It's sad to say that India is going in the other direction. Now let's have just a quick look at the United States. Here's the tracking information from the States. So these are cases. Now they've updated this site and you can play with this and get all sorts of really quite interesting data on it. You know, once you're on it, you tend to be there for about half an hour. You think, oh, I'll just have a look at that. But anyway, just to summarise it, cases are starting to go down in the United States now. Now, this is quite a relief, I must say, because we had feared. Well, we did anticipate this increase in cases in the US, but we feared it would go higher, but the vaccines do seem to be catching up. So that is... But still bear in mind, that's the 50,000 cases a year line down there. So we're still looking at 54,000 new cases in that 7-day moving average. So it's still quite a lot. Now, how do we do this? Left axis, daily deaths. There we go. So deaths also down, but again, much flatter than we would like to see. So 7-day moving average for daily deaths, 661. So still need the vaccine program to carry on in the States. And unfortunately, from my reports, complacency has broken out all over the United States, and that's working the other way to the vaccines. Now, vaccines in the United States, this is the Pfizer-BioNTech vaccine leading the charge, 120 million doses. Moderna, 100 million doses. Janssen, Johnson & Johnson, back now, of course, and increasing in doses. Now, on that topic, here's the CDC update. Again, I include the link for your perusal. Make sure I'm not misinterpreting this. That is the link on the restoration of the Janssen, Johnson & Johnson vaccine program. I'll just give you a few headlines from that. CDC and the FDA recommended the restoration of the use of the Janssen, Johnson & Johnson, which is good. Reports suggest an increased risk of rare adverse events called thrombosis and thrombocytopenia syndrome. So that's what they're now calling it. They're calling it TTS. I think we know this now. The thrombus is the blood clot where there shouldn't be one. The thrombocytopenia is the low level of platelets in the blood. And as I think most of us know now, it's the platelets that are necessary for blood clotting. And syndrome is a collection of possible symptoms, because there are a collection of possible symptoms here, like AIDS, acquired immunodeficiency syndrome. It can present in a wide variety of ways. So that's what they're now calling that. We know the numbers, of course, were very, very small, rare. Well, we looked at the figures quite a few times. They were around about 1 in a million mark, weren't they? It was very, very rare. Nearly all reports adult women younger than 50 years old. So this seems to be affecting premenopausal women, albeit rare. Now, I quoted these figures quite a few times. I can't remember them offhand. It was, what was it, about 1 case per 1.2 million vaccinations? It was very, very rare. Very rare side effect. But that's why they paused that rollout. Potential benefits outweigh known and potential risks, according to the CDC and FDA. But their proviso is women younger than 50 years old should be aware there are other COVID-19 vaccine options available. Well, not in the UK, there's not. You just get the one you turn up and you're given it. But if that's the case in the US, then that's fine and it makes sense. Now, I've got something else on vaccine in a minute. Let me just briefly tell you. For 3 weeks after receiving the vaccine, look out for possible symptoms of a blood clot with low platelets, and this is what they advise to look out for. Now, if any of these do present, of course, you would seek immediate medical attention. Severe or persistent headache with or blurred vision, shortness of breath, chest pain, leg swelling, persistent abdominal pain, or easy bruising or bleeding, which would indicate low levels of platelets. So that all makes sense. You would get immediate medical help. And of course, doctors now know they're not to give heparin for this condition, which was part of the reason for the delay of the rollout. Now, I don't want to create any problems with the vaccine program, because vaccination is essential. More therapeutics would be good, more prevention would be good as well. Again, I'm not trying to separate these components. I think that's really unhelpful to do that. But Israel has led the way in the Pfizer vaccine, of course. And Channel 12 on Israel reported on Friday. This is from, read about this, is the Times of Israel, I think this is from. It's also reported by Reuters. More than 5 million people vaccinated, but 62 recorded cases of myocarditis. Now, we're not saying these are caused by the vaccine yet, but this is one of these apparent correlations that have come to light. Now, the myocardium, of course, is the heart is pumping away all the time, and the myocardium is the contractile muscle of the heart. So that's your bicep there, that's your tricep there, that's what makes your arm move. The myocardium, myo muscle, cardium heart, the muscle of the heart. And itis is inflammation of. So in Israel, they're reporting, this is a leaked report, it's not out officially yet, but they're reporting 62 cases of myocarditis. 56 of those came after the second shot, and of course the only one is the Pfizer vaccine, so these are mostly after the second shot. So presumably that means 6 were after the first shot of the Pfizer vaccine. Most of the affected were men under the age of 30. 6 of the patients were treated and released from hospital in good condition. 2 deaths, unfortunately. Details have also been sent to the US Food and Drug Administration Centre for Disease Control, who are also investigating this. And of course, the Israeli medical authorities work very closely with the CDC and the FDA. Rightly so, because it synergizes their information. Now, if you think about it, the incidence of this side effect here is much higher than what we were reporting on the blood clots, the thrombosis and thrombocytopenia after the Janssen, Johnson & Johnson vaccine. This is 62 out of 5 million. So it's a higher amount, although 56 thankfully went home. So basically what I'm pointing out here is the adenovirus vaccine seemed to have got a bit of a bad press, really. It's based on data, but there's problems with all vaccines. And well, I think that's fair to say there's problems with all vaccines. Anything that works can have potential side effects. So, but we need to be smart, and I'll show you how I think we're probably going to do that. But let's just carry on with this report about the Pfizer myocarditis side effects, or potential. Let's call it. At this stage, we're certainly not calling it side effects. We're just calling it correlation, or excess of cases. It's being investigated at the moment. One possible reason for the lack of similar findings in other countries was the low rate of vaccination amongst younger people. So Israel, of course, vaccinated a lot of younger people, whereas the US and the UK and quite a few other countries are vaccinating older people. So if it turns out that this is a complication, of the Pfizer vaccine, then Israel will probably be the first place to see it if it's a complication that's affecting younger people. We don't know. We're just flagging this up as a finding from the Times of Israel and Israeli TV at the moment. There's a specific concern regarding the frequency of occurrence observed in men under the age of 30 days immediately after the second shot. So these are in quote marks. So this is the Times of Israel quoting the report. They say they're quoting the report. So younger men at this stage, according to initial findings, that still needs to be verified. There's an impression that the number of cases is higher than you would expect, especially in those under 30. So overall findings of this complication, or of this correlation, 1 in 100,000. Younger people, 1 in 20,000. And I think that's younger people altogether rather than just young men. So it's just strange that there's been such a lot of discussion about the Oxford AstraZeneca vaccine, especially in Europe. Not yet approved in the US, of course. They're waiting for their own trial data, which should really have been out a while back. I don't know why that hasn't been out yet. And yet we see potentially this with other vaccines, because there's a potential risk anytime an active treatment is given. I think there's a potential risk. So that is, 1 in 20,000 young people. That's getting on for being quite high. That, isn't it? Certainly higher than the blood clots with the Janssen vaccine. Are these findings duplicated in the States? Don't know yet. We have to wait and see. We cannot yet tell if there is more cases than normal or if there are similar numbers annually and the proximity is just a coincidence. So we don't know yet, is what the Israeli report is saying. Of course, they're carrying on collecting data, as you would certainly expect. Now, in Israel, children aged 12 to 15 plan to be vaccinated when the United States FDA authorises the vaccine for that age group. So here, the Israelis are vaccinating, or are going to start vaccinating, depending on FDA approval. So they're actually following the FDA rather than their own authorities. They're using the FDA as a proxy for Israeli authorities by the looks of that. Health Minister in Israel, once that age group has been vaccinated, the country will reach herd immunity. So remember, and that age group that they're talking about there is 12 to 15. So once the adults have been vaccinated and people down to the age of 12 have been vaccinated, what the health minister here is saying is that Israel will reach herd immunity once that age group has been vaccinated. Therefore, no need to vaccinate younger children, which is encouraging. So, given what we know, now, when this vaccination program started, I said, what we will probably find is that a particular vaccine works better in a particular group. So one vaccine might work on older people, one vaccine might work on people with diabetes, one vaccine might work better on younger people. That's what I thought, or men and women, or whatever it is. It turns out that the vaccine choice may be the one that minimises the side effects. Now, this is good news in a sense, because it means all the vaccines are essentially working well at reducing hospitalisation, serious illness and death. So the choice of vaccine may well be the choice that minimises the risk of side effects. So given what we know so far, vaccine choice may be that younger women might be better advised to take the Pfizer vaccine. That's a possibility. And that younger men who may get the side effects from the Pfizer vaccine are advised to take the Janssen vaccine. So we know that in the States, younger women are cautioned against the Janssen vaccine, so maybe they should take the Pfizer. In Israel, it seems that younger men have been having a problem with Pfizer, so maybe they should take the Janssen. So interesting, the States are advising younger women to be cautious with the Janssen. The data from Israel shows younger men may be more affected adversely by the Pfizer. And given that that is the case, maybe authorities around the world will start saying, well, younger women have the Pfizer, younger men have the Janssen vaccine. Will this be the case? It could well be that vaccine choice, when we have a multiple choice of vaccines, are determined by minimising side effects rather than optimising beneficial effects. Now, just one more thing to show you. This is from. You can't see that. I tell you what, I'll do that tomorrow. We'll leave it there for today. That's enough for today. We'll look at those cases in the Czech Republic tomorrow. So that gives you a motivation to. That gives you a cliffhanger, doesn't it, for tomorrow? Now, was I going to do anything else today? No, I think they're the main things for today. So, as always, thank you for being with us.